A lot of patients and prospective patients bring up to me the facts of what's going on the internet. The internet really has become a free-for-all. It's like the wild, wild west. Everybody who just recently graduated 6 months or 2 years ago is an expert in everything. Everybody is world-renowned. Everybody says they're famous. Everybody has done this or that. What's really the truth? How are you going to find out the truth about your surgeon? Particularly, I think in the area of Brazilian butt lifts, it's become a little bit crazy out there. I want everyone to know what to do the right research. First of all, it's important to know, we've already discussed it's important to be part of the American Board of Plastic Surgery, perhaps the American Society for Aesthetic Plastic Surgery, and beyond. In addition to that, what makes somebody an expert is if your colleagues and your plastic surgery friends and colleagues around the world invite you to go lecture to them your techniques and philosophies so they can improve their practice, learn from you as you learn from them when you travel, that's what makes somebody an expert. And so for me, I've had the fortune of being invited to Brazil this year to talk about Brazilian butt lift as one of 2 US surgeons. And I think that's a big deal for someone to be invited to Brazil to talk about Brazilian butt lift. In addition, I'm going to Istanbul, Turkey. Next year I go to Milan, Italy. Next week I'm going to San Francisco. I have lots of meetings coming up. So I'm very passionate about this topic, as I am about several other things that I do, including rhinoplasty. And so this passion is translated to good work, good philosophy that my fellow surgeons think are important enough to invite me to go all the way to their countries to teach them and to share our ideas and further improve everything we do. Now, as far as the internet, it's important to know there are surgeons out there, unfortunately for you, that are not showing you the reality of what's going on. They're photoshopping their results. They're showing you just one view, a close-up view. It might not even be the same patient, it could be someone else. And it just gives you one little angle of what's really going on. You need to show at least 2 to 3 views of a surgery results to know what's going on. If you're showing the buttock photos, you have to show the behind photo and either slightly turned or a profile. You can't just show one and assume that that patient looks good in every other angle. So your surgeon needs to be honest in his photo gallery. Secondly, there's a limit to how much fat you can put in each person's buttock. That goes by experience. Nobody can tell you what that limit is. It's based on experience. I've done where I have a ton of fat to use and I'm putting as much as I can in. It literally shoots back at me through the incision holes. I know that at that point I definitely have to stop. It's going to become a rock hard buttock. There's no more room. All the tricks in the tray that we can use to expand that skin to make more room, they're exhausted. There's nothing else I can do. There's limitations to everybody's body and results. There's bone structures that are tall and flat. There's people that don't have that much fat. There's people that are small but have very dense fat. The goal here is we don't want to make the same mistake we made with breast implants 10 to 20 years ago. You do not want to put huge breast implants in for the same reason why you don't want to put as much fat as you have in everybody's buttock. What's going to happen over the years, that sags, it gets heavy, it stretches the skin, it causes problems. This requires experience to know when is enough and what is the maximal amount you can put in somebody. This is not about a contest to see who can put how much fat in everyone's buttock. To take someone who's 5'1", weighs 110 pounds, and on the internet to say that you're putting 1,000 cc's in each buttock, I'm sorry, and I'm willing to bet my life on it. That is a straight lie. That's dishonesty, and what's that doing is luring people into the practice because they're saying, I put a lot more in the buttock, or it's the same thing as saying, I put the biggest breast implants in. That's not necessarily a good thing, and it's certainly not a good thing if you're being dishonest about it and tricking patients to come into your practice with smaller bodies and claiming that you can put 800, 1,000 cc's in almost everyone on each side. This is very dangerous. Do your homework. They need to be a part of the different societies. If someone's claiming to be an expert or a specialist, ask them why, research them and see what makes this person an expert, because everybody says they're an expert. Are they writing book chapters? Are they being invited to write textbooks and articles in the journals? Are they traveling the world and going to the conferences and sitting on expert panels? The majority of the time, no. There's a very small amount of people that have the privilege to be able to do that. Thank you very much for your time.